In Modena there appeared an illness that lasts 3 days with a great fever and headache, and then they rise. But there remains a terrible cough that lasts maybe 8 days, and then little by little they recover and do not perish. Tommasino de Bianchi, 1510.
The flu was first identified and documented in historical documents about 300 years ago. However, there's not a great consensus as to when influenza first started affecting humans. For example, there are documents of influenza-type illnesses going back 2,400 years, even documented by Hippocrates and others in ancient history. Many are familiar with the flu pandemic of 1918. It's also known as the Spanish flu.
Influenza probably had what was called an antigenic shift, a completely new influenza virus that really had not been circulating in humans, so therefore had no or little pre-existing immunity.
Now that novel virus, which emerged in 1918, coincided with World War I, and the conditions of overcrowding and global troop movement helped it spread and caused it to be so bad.
The Spanish flu had about 600,000 deaths attributed to it in the US alone, and obviously millions of deaths attributed to the 1918 Spanish influenza globally.
We didn't even know what the microbe was. When they were dealing with it, many people thought it was some strange form of a bacteria and not necessarily a virus.
It was not until 1933 that Richard Shope and his mentor Paul Lewis at the Rockefeller Institute isolated influenza A.
It wasn't until about 3 years later that we identified influenza B. Both of these experiments led us to understand the characteristics of the virus and the development of future vaccines.
Every year with the seasonal flu, we do see crunches in the hospital system. We see shortages of beds, especially ICU beds, ventilators, and additional support, such as nurses and even physicians that are a limited resource in flu season. So you can imagine if we have a community that is not vaccinated against influenza and we add an ongoing coronavirus epidemic, we're likely to see even more restricted access to medical care, hospitalization, and those life-saving interventions like ventilation.
When we look back about 10 years, we see that there have been approximately 9 to 45 million illnesses in the United States alone. Deaths over that period of time have ranged from somewhere between 12,000 and 60,000 deaths.
People that are at high risk of developing influenza complications, hospitalizations, or death have a much lesser risk of suffering those complications if they're immunized. Hence why there's really a recommendation for universal influenza immunization for anyone 6 months and older.